Hey, what is up, everyone? This is Julie here, and welcome to another super clip. In this clip, I'm going to be talking to you about the raising of the head of bed and the chair. Yeah, the chair. But before I get started, as always, I would like for you to smash that subscribe button, kick the like button on this video and all of my other videos, and don't forget to ring that notification bell so you can be notified whenever I upload new content. So first, we're going to talk about the head of bed, okay? And particularly pertaining to the testable skill feeds client who cannot feed self. So the head of bed has to be raised to a high Fowler's position anywhere between 75 and 90 degrees. What is 75 degrees to you is not going to be 75 degrees to that NAE. So in order to lower the risk of that NAE misperceiving the angle of the bed, it's best to go ahead and raise that head of bed all the way to 90 degrees, okay? The client or the candidate that is acting as the resident can always readjust themselves, okay, once that head of bed is raised to 90 degrees. So that's what I'm doing right now with Nurse Annie. I'm raising her head of bed all the way to 90 degrees. There we go. That way, the NAE is not going to question or have any questions as to whether or not that bed is in a high Fowler's position. Okay, so your Nurse Aide Candidate Handbook tells you to be anywhere between 75 and 90 degrees. But again, what is 75 degrees to you may not be 75 degrees to that NAE. So it is very important that you, the Nurse Aide Candidate, raise the head of bed all the way to 90 degrees, okay? Now, that's it with the head of bed. Again, with this skill, make sure that the head of bed remains raised even after you complete the skill. You do not want to lower the head of bed, okay? Keep the head of bed raised. So actually, the raising of the head of bed to a high Fowler's position is the critical element in this skill, okay? So you want to make sure that you don't give the NAE any room to question whether or not you have raised that, whether or not you have raised the head of bed to a high Fowler's position, okay? Now I'm going to talk to you about the chair. In this skill, it specifically requires the candidate to sit while feeding the resident, to sit while facing the resident, okay? If you position your chair like so and you're sitting like this, you are not facing the resident. The only time you're facing the resident is when you turn to feed the resident. So if you place your chair like this, okay, face forward, you can always turn it to the side. Now you're facing the client, okay? Better yet, go ahead and just position your chair in this manner, okay, right in front of the client. You can take the overbed table, and I'm going to raise it up just a little bit, and place it like so in front of the client, and you have your chair on the other side of the overbed table, okay? This is actually killing two birds in one stone, because now you're setting the person's meal tray here. Let me lower this down some. Setting the person's meal tray here, and one of the steps in this skill requires the Nurse Aide Candidate to place the person's food where that person can see it. So that's one stone. The second stone is actually now with your chair positioned as it is, you are directly facing that client, okay? So now all you have to do is, once you tell the person what food items and beverage, don't forget to tell them the beverage, okay, what they have to drink is on their tray, what they have to drink, and then you ask them, give them a choice of what food item they would like to start with first. Now you can start feeding, okay? So this is how you should be positioned or seated in the chair for this skill, okay? Do not sit on the person's bed, infection control, okay? Don't sit on the person's bed. You have to have a chair, you have to be seated in the chair, and you have to be seated facing the person, okay? So that is it for this clip. I hope you all are enjoying the super clips that I'm now producing and uploading to my channel. Hey, let me know how you like it, okay? Leave a comment in the comment section below this video and any other super clip that I upload, okay? So, as always, before I leave, I want you to smash that subscribe button. Again, especially if you are new to visiting my channel, kick the like button on this video and all of my other videos. And don't forget to ring the notification bell so you can be notified whenever I upload new content. Hey, go ahead and visit my Etsy storefront. That's where you can purchase some of my YouTube merch. Even if you don't purchase anything, go ahead and give my storefront a heart, or any item that is listed on my storefront, give it a heart, okay? That will make my storefront more recognizable to the public. Also, don't forget about my new channel. I'm trying to reach 1,000 subscribers on that channel. If you just type in Julie Reynolds, nurse aide instructor, or Julie Reynolds training, my channel should be the second channel to pop up on YouTube. Click that subscribe button, tell all your friends, tell your instructors, because my second channel is actually for instructors, but the information that I give, the demonstrations that I do, will also be beneficial to you, the nurse aide student and candidate. All right, so that is it for now. I look forward to uploading another super clip. Hope y'all are enjoying. Thank you.